Welcome all to Concurrent number 3, Practicing Responsible Artificial Intelligence AI, Risks, Challenges, and Opportunities. My name is Rodrigo Teixeira, Head of the Biome and Digital Health Solutions at Novartis Canada. We are thrilled to be sponsoring eHealth 2022. The program is really in line with our values and aspirations at Novartis Canada to foster and build communities that are willing to come together to tackle the biggest healthcare challenges. This session is a panel discussion format. If you have any questions or comments for our panelists, please type them directly into the Zoom chat and we'll address them as time allows. You are also encouraged to connect with speakers after the session via the virtual platform. Now it's my pleasure to announce and welcome to the virtual stage our 3 panelists. First, Dr. Suman D, Head of Government Healthcare Solutions, Infosys Public Services. Dr. Ritu Agarwal, Distinguished University Professor at University of Maryland. And Diya, Wynn, Senior Practice Manager, Emerging Technologies and Intelligent Platforms at AWS. Dr. Suman, I'll hand it over to you now.
Thank you, Rodrigo. It's a pleasure to be in this forum and talking about such a crucial topic, which is in everyone's mind whenever we are thinking about how to operationalize AI. And I'm fortunate to have joining with me Ritu and Diya, who would also share their perspective, especially around what they are seeing, in the real world scenario when executing projects around healthcare-related and artificial intelligence technology blended. So when I, starting off the conversation, I think it's important to realize that AI in an organization is not only about technology. It's a way that you think about the stakeholders who involve right from the people process, including the environment aspect. And importantly, there are everyone who would want to understand that how your AI outcomes are impacting your decision making on a day-to-day basis, and what would be certain things that they want to ensure that things are being approached in a perfect way, that there is no bias, there is no negative impact or outcome that you get through this artificial intelligence technology when you experiment it within the organization. So be it with your COO or a chief security officer who wants to understand that how is your AI model transparent? Is it auditable? Is it compliant with all the regulatory requirements? Your chief technology officer or your chief analytics officer wants to understand that how you have the right pre-mortem process and what tools are you using so that the models that you are developing has got the right decision-making ability and doesn't impact your constituent lives in a different way. Similarly, for a data officer, you think about the way that you can bring the checks and balances and ensure that the data is pre-processed and bias-free when you bring it into your AI model development. As a policymaker, you need to ensure that when you are directing something as a decision that will have an impact on a particular community, it is trustworthy and they are fair enough and justified. And from a CIO standpoint, it's important to consider that you are not overusing technology too much that is going to impact the environmental outcome, and especially with the computational power that we think of leveraging when there is a huge amount of data set. How can we reduce our carbon footprint? These are certain important considerations that everyone needs to be aware of before even they jump into their AI journeys. Another important aspect of this is to understand what are the common pitfalls when you do an artificial intelligence related project. The inherent challenges that comes into the project is bias, because these projects are all human driven, human initiated, human controlled. So somewhere or somehow there are unconscious level where bias get integrated into your decision making. And that is driven by the data that you bring into the AI model. Similarly, do you have the enough understanding of the models being developed? Can you interpret those models? Can you explain those models to anyone beyond who has developed it? So that is the critical aspect of driving transparency end to end and bringing explainability so that it's not difficult when you are making use of those AI models in a real world scenario. And what would be the solving tenets? Drive it through an ethical parameter, bring in the aspect of your legal social structure, and ensure that there is enough safeguard with respect to your data privacy, data security, you have an auditability and explainable framework to ensure that whatever the models have been developed and how they have been developed are on an ethical parameter. They can be reproduced. It is not just a one-time shot. It has to be developed in a way that each time you create those models and try to replicate in a business solving scenario, it is repeatable and had got identical results each time with lineage of traceability as well as the data that you are using. So it's more of like bringing the best understanding of the model, how they have been developed right from the source to the target aspect. And even if there are drifts, you know that how the drifts are happening. And lastly is the purposefulness of the model. The recommendations that you bring out, you vouch on that, you can trust on that, and they are aligned to ensure a better outcome for your end user. From a patient community standpoint, it's very important, but because today AI has been used in healthcare in a huge way in different dimensions, rightly from targeting some of your community health program in order to do equitable adjustment of your resources to safeguard the socially vulnerable, as well as driving patient engagement and taking it all the level into healthcare research and studies that can drive more better outcomes in the future. So what is required in order to ensure that you have an ethical AI and an experiment atmosphere? The most important thing is to ensure that you have a robust governance in place. And that is to make sure that you know how to govern those projects, what to govern, how to track those outcomes, what are the risks that you have to address, and what is to be used from a technology and tool standpoint. So right from your study design to your AI system development to implementation and the data that you bring in, you need to ensure that they are properly been coordinated with every stakeholder who has got their ownership and the skin in the game, and they are being powered with the right decision making capability, with the controls, with the accountabilities and issue management techniques. And your data life cycle throughout the journey of your AI experiments has to be confirmed with the right standards and the quality, so that there is least and no, or I would say that no adverse impacts with respect to your AI model recommendations. Finally, what I think is the critical feature to ensure the AI experiment is you have to build it on certain value levers. And as I said, from a governance standpoint, that's important to create a unified structure. You should have a risk management technique that can ensure that your models are unbiased, they are compliant with the regulatory requirement, and they have less drift and negative impact on the performance and the outcome. Your technology choice becomes so important across the data lifecycle management is to drive it not only with an agile fashion, but more with accuracy, transparency, and fairness. You have to have a COE that can be well versed with all the required technology trends, the best use of whatever mechanism and techniques that they want to bring in, and how they take into account the different dimensions of responsible AI. Similarly, from a model lifecycle management, as well as assessing the outcome by driving it through a human-centric design, where you can take into the different scenarios in accounting, the bias, the fairness, accountability, robustness, drift, and security. All it gives you is the success dimensions that you can account for is what is your capability to accelerate the performance of this AI model development? How can you scale them up with your custom architecture, which is conforming to the environmental security as well and reducing the carbon footprint, and equally related to the compliance, especially the privacy and data security, and give you an outcome which is well distilled, which is completely ethically driven, and provide you an accurate prediction for your healthcare outcomes management. So with this, I will pass it on to Ritu, who can take you through some of her examples and the experiments that she is doing and how she is bringing the perspective of AI into responsible AI into her AI experiments and journey. Ritu, over to you.
Thank you, Suman. Good afternoon, everyone. I'm delighted to be here as well. I'll keep my remarks brief so we have a little bit of time for audience interaction. Just to set the stage, I want to provide the background for where my remarks are coming from. I am an academic, I'm a professor. I'm also the founding director of the Center for Health Information and Decision Systems. And for the past 15 years, we've been sort of riding the digital technology wave, if you will, from electronic health records to wearables to sensors, and now, unsurprisingly, to artificial intelligence. And we've been asking questions such as, what does it take to generate value from all of these innovations? How can we use them to drive healthcare quality, patient safety, health equity, and cost? Now, the second set of experiences are a little bit more academic, and it's related to training students, both at colleges and universities, but also those who are in the professional workforce and who are working in healthcare organizations and implementing artificial intelligence solutions that directly affect healthcare decisions and healthcare outcomes. So my remarks are somewhat subtitled, A Call to Data Scientists. And what I'm going to present in the next 5 minutes are some models and frameworks that we've been focusing on to shift the conversation to health equity, to see how we can use artificial intelligence to ameliorate and not amplify any biases that might already exist in the way in which we practice healthcare or the way in which we deliver healthcare. So let me start with a good news story. And the good news story is really about, well, what can AI ML do for us? I don't think there's anybody in this audience who's probably not familiar with this, but it's worth reflecting on the power of machine learning and what we can do with all the treasure troves of data that we have digitized over the past 15 years. A couple of years back, there was a World Medical Innovation Forum where they identified the disruptive dozen, and these were going to be sort of the incredible outcome applications for AI ML. And I'll just speak about a couple because they are related to health equity in some ways. Now, we know that there are large parts of the world that are under-resourced in terms of access to healthcare resources, that do not have the kinds of professionals that we need to deliver healthcare, and especially for conditions that are complex or chronic or rare. So one of the big roles that AI and ML can play here is to simply expand access in underdeveloped or developing regions. Just as an example, there are more radiologists on one street, Longwood Avenue in Boston, than there are in all of West Africa. So that immediately points out that we have such an inequitable distribution of resources, and perhaps we can use AI and automated algorithms to address that gap. Second one I'll mention is the burdens of electronic health record use. If we have clinicians in the audience, I'm sure you can appreciate what I'm saying, that electronic health records, even though they were envisioned to change the practice of medicine, the reality is that they are still incredibly burdensome. They pose a large cognitive effort on physicians. So if we can use technologies such as voice recognition, automatic transcription, or just scanning through clinical notes and discovering intelligence, those are all ways in which we can help clinicians as they practice medicine. I want to say a couple of words about an Instagram story that was posted in the Washington Post a couple of days back. And the point that I want to make with the Instagram story is that algorithms can be pernicious. Algorithms can be wicked, if you want me to use that phrase, and algorithms can be evil. So this particular Instagram story speaks about a father whose child was born during COVID, and because of the isolation caused by COVID, he decided to post a picture of the baby on Instagram every day. And soon thereafter, Instagram's algorithm started showing him pictures of babies who were suffering, babies who had chronic conditions, and so on and so forth. The bottom line here is, if we cannot inspect the algorithm, then we are always at risk for unanticipated results. And we're always at risk for perhaps amplifying health disparities rather than reducing them, especially when individuals are in poor health. They tend to be more vulnerable and more susceptible to these types of images. So what can we do about this? As I mentioned earlier, we have been developing frameworks and models to help us think through the challenges of health equity and reducing disparities through AI ML. So let's take a very simple view of what healthcare delivery looks like. At its very fundamental level, there are three sets of decisions that are made in healthcare delivery. Administrative decisions, such as deciding how to schedule patients, figuring out whether there are some missing pieces of information in a patient's record. Diagnostic decisions, the doctor examining the patient and making a diagnosis about what the possible medical condition might be, and then treatment, deciding what the appropriate course of action should be given the patient's health condition. All of these three decisions, these interrelated decisions, are made in a broader context. So let's take a look at that broader context. There are system level choices that health delivery organizations make, and these system level choices could be things such as what insurance to accept, what is the racial and ethnic makeup of all the employees who work at my hospital, where should I locate my healthcare delivery facilities if I have ambulatory facilities, and importantly, all of these decisions are made on a foundation of structural inequity. As we know, many Western societies have embedded beliefs about individuals, embedded beliefs about races, and about how the health conditions of individuals and races differ. And not all of these beliefs are necessarily founded in fact. Not all of these beliefs are necessarily grounded in evidence. So as we embark on any AI/ML project with the goal of amplifying health equity, we need to be aware that all the decisions are being made in the context of this structural inequity. So how do we move forward? What we have developed at my center is a framework, and I don't have the time to get into the details here, but we call it a bias-aware AI process framework. And it challenges data scientists at every stage of the AI/ML development project to question how the problem is being scoped, what type of data are being used, what types of models are being used, and then how those are being used to inform decisions. So let me give a couple of examples to flesh this out. With data, we have a systemic problem of not enough data availability about underrepresented and marginalized populations. Just as an example, the Genome-Wide Association Studies database has 78% individuals of Caucasian descent and only 1% that are African American. Likewise, all the biobanks developed in the United Kingdom do not include individuals from low-income households or from areas that are less resourced than other urban areas. So immediately we see that we have a situation of data poverty, where certain classes of society and certain populations cannot benefit from the advantages that might be offered by AI and ML. In the model phase, we all know that off-the-shelf algorithms perform best for the majority group because all they're trying to do is maximize the predictive value. Now, there are some technical ways in which you can adjust those models, such as upweighting data points, transformation learning, bias dashboards, et cetera, So the call to data scientists is to make sure that they use all of these tools. Now, what's the path forward on our journey to health equity? I'll just close with the following consortium that's just been developed. The National Institutes of Health has launched a new program called AIM Ahead. It's the Artificial Intelligence Machine Learning Consortium. And the specific goal of this is to advance health equity and researcher diversity. Until we have data scientists that represent all populations, all backgrounds, all skin colors, we will never be able to incorporate the specific needs of those populations into our AI/ML solutions. So for me, practicing responsible AI is all about training our data scientists, diversifying our data scientists, so that they can take health equity considerations into account. Thank you, and I will now hand it over to Diya.
Greetings, everyone. Thank you so much, Ritu and Suman. It's great to be in this forum and have the opportunity to share with you all today. I am a global practice manager at AWS, and different than Suman and both Ritu, I get to share from experiences working directly with mostly enterprise customers, as well as some in the startup space and some of our partners. And I'll round off my remarks and comments really talking a little bit about technology. Now, much like what Suman mentioned earlier at the start, there is an overall framework, an approach, an operating model that should be considered when we're thinking about responsible AI. And in particular, whether it's healthcare in this particular case, but any industry, we should really be thinking about this holistically, as he described, around people, process, and technology. And Dr. Ritu also mentioned specifically, a call to data scientists, but there is a call and a responsibility we all have to playing a part in every role in the machine learning lifecycle really has a benefit for us. Now, I start off really with bringing our attention to some specific use cases where we see AI, ML, and machine learning helping, in particular around healthcare. And these examples are likely not new to you all, and maybe very similar to some that you have seen or actually are working in. When we think about modernizing care and infrastructure, the healthcare industry really deals with a lot of data around prescriptions or claims, medical forms, imaging. And with machine learning, we see simplification of those processes and their ability to distill information from the complicated health records, or use natural language processing in order to be able to extract text. These are some of the capabilities, whether that be an increased customer engagement using AI services and chatbots, or protecting patient privacy. All of these are, a number of cases or examples that we see AI being used in great ways. As Dr. Ritu mentioned earlier, as we see these use cases increase, we also have to be aware of some of the potential barriers or challenges around AI's use. This particular chart is one that I reproduced from some information from Gartner on AI in organizations. And I believe the study was from 2019, where they're highlighting some specific barriers to implementation, or things that we really should be elevating our concern around as we look at leveraging AI in more ways to bring about equitable outcomes. And there are three top barriers that I wanted to call our attention to specifically. One of the top barriers around the risk and concerns, right? Things that get in the way, and just our general understanding or awareness of what those risks are, and then the ability or the capacity to be able to address those. The other would be around security and privacy. And then data volume and complexity. Now, when we think about understanding the risk, I think it's important for us to be conscious, or probably even a better word is intentional, about how we approach and address risk. And that's one of the things that perhaps isn't considered enough as we look at, determining what problems we look to solve, or the ways in which we can leverage AI. Are we being intentional and conscious about understanding the entire population that could be affected, ensuring that voice, as Ritu was mentioning, is being included or considered in the approach as well as the outcome. And when we think about that in the context of data, that's including adequate representation from all populations, right, that might be impacted, understanding where there might be variance, and thinking about or considerations as to whether or not those examples generalize in a way that would benefit populations. We certainly saw that being the case when we think about some of the use cases throughout COVID and the pandemic, as we tried to respond to that situation. Then with AWS in particular, we have a platform that provides us some support and structure to be able to address some of the areas of risks and concerns that we should pay attention to. Now, I won't dig heavily into this particular slide, but the intent is that as we look at building, not just on AWS, but any platform for that matter, thinking about the kinds of services that can be employed to ensure that we're addressing, concerns concerns around privacy and security of our platform, the data and the workload. And then also having the consistency that we need to provide transparency and the necessary control in that environment. So the final slide that I wanted to focus on and just highlight in terms of how we look at responsible AI. And the prior, I talked about some sort of standards, some baseline things that are available to us in the platform that should be considered. But then when we think about services and the ways in which we can start to employ or operationalize responsible AI is leveraging some technology. So we talked a little bit about people having the awareness and the understanding of where risks are concerned, ensuring that they have appropriate education and training so they understand where to consider risk, ask the right questions, ensure that the right populations are considered, the processes, the governance structure that was talked about earlier, and then the supporting technology or services that help align those things and ensure that we have traceability where we can look at the model lineage and understand from where data was prepared through model development, where there might be changes or how we can audit that at any point in time. That also gives rise to us having the right transparency in place, or some other tools like our SageMaker Clarify that gives us explainability so that we understand not just where AI is being used, but also how it's coming to make certain inferences or predictions that are then later being leveraged in decisions in terms of patient outcomes or care. Being able to monitor the models appropriately to ensure that we know what's happening when there are shifts, what we actually do, and then putting in the right sort of accountability or response from a human involvement consideration. So those are some of the technologies or services that we have that we can leverage in order to be able to look at or operationalize, have in practice in the organization, the things that would drive accountability, greater privacy and protection, traceability, explainability that's necessary in our overall picture. Now, in these last minutes, I will just say that one of the critical things, as you all have heard, hopefully have been able to take away, is as we think about leveraging AI in greater ways, there is great responsibility and care that we need to take, intentional responsibility and care that we need to take to ensure that we are have the right sort of structure, people awareness, and technology in place to really drive more equitable outcomes. And with that, I'll turn it over to see if we have any questions.
Thank you, Diya. I think we are just running about time. I'm not sure if you have time to get questions, but I will encourage the team and everyone who is around to really connect with our panelists in the virtual event platform. And in the meantime, I just want to say thank you very much, Dr. Suman, Dr. Ritu, and Diya. This topic is just fascinating. It's not fair to only have half an hour, but some things that I took away is this using AI for actual adjustment in the resources that we have, this notion of data poverty, and then how maybe we can fix that so we can have a real reflection on what's happening around the world. And I love, Diya, what you said at the end, intentional responsibility and care. I think that's our duty in this industry to patients and to society, so we can improve the lives of everyone. So again, thank you very much, everyone. I encourage you again to join the networking lounge and access the virtual platform to connect with our fantastic panelists. And I wish you a great rest of the day.